Hi everyone, Sherry Dastoriba here, and this video is a Franklin method practice for the hip and pelvis. If you are a runner or an athlete or just generally want more strength, stability, better function around the hip joint, especially if you're dealing with any IT band issues, hip joint stuff, SI joint stuff, this can be a really helpful strengthening practice. The kind of more therapeutic clinical version of this could be clamshells. So if you're familiar with clamshells, keep going, use your awareness while you do them to make them more effective and actually feel in the body the strength that you're gaining. And if you'd like, add this practice to your repertoire so that you can get more functional stability and strength built into the pelvis as well. So like always with the Franklin method, we want to check in first with our baseline. So what I mean by that is setting aside your to-do list, mental distractions, not thinking about the body, but instead sensing and feeling current physical state. So take a moment and check in with your posture, sensation, tension in the body, and actually feel this moment, what your body has to tell you. Go ahead. Good. If you closed your eyes to do that, go ahead and open them now. And for the sake of another test, another baseline, go ahead and stand on your right foot. Check it out. Notice how it feels. Good. And stand on the left foot. Check it out. Notice. Good. Setting that foot down. Excellent. So bring the hands to the sides of the pelvis. This is the ilium or the rim of the pelvis. Go ahead and find that shape. You can press down with the hand and get acquainted with the rim of the bowl or the rim of the pelvis there, the iliac crest. And from the sides of the ilium here down to the outer hip, we have these muscles, fan-shaped muscles, called glute minimus and glute medius, or gluteus minimus and medius. It's that outer or lateral hip strength that is often really quite key for some of us, okay? So hands on the ilium, stand on the left foot, right leg is out to the side, and we're gonna swirl the right femur in and then swirl the right femur out. So we're turning the thigh in. Those posterior muscles of the hip can spread and widen, and then as you turn out, they're going to engage or draw the femur back and around. So slide them apart, turn in, slide them together, turn out, slide them apart, turn in, slide them together toward the sacrum, turn out. One more time, slide them apart, and slide them together, turning out. Good. Step onto the right foot, weight bearing on the right side. The right side still has your awareness, your attention. And we're gonna swivel the whole pelvis around the right femur head. Pelvis in and turning out, kind of imagining that you're polishing the femur head with the socket, swirling in, swirling out. Two more times, swirl in, swirl out, turning in, turning out. Good. Come back to neutral. I'm standing on my right side. And when I stand in normal, healthy posture, my pelvis is usually fairly level. We're going to exaggerate this, drop the left hip down, and those fan-shaped lateral muscles are moving, stretching, spreading apart. Hike the left hip up and feel that outer right hip contract, kind of like pulling up pantyhose or tights on the left side to contract right outer hip. You can put your hand there. Left side of pelvis drooping, dropping down a little. Left side of pelvis lifting up. Contract the right. 3 more times. Breathe, left hip drops down. hip hike, left hip up. Last time, left hip dropping down. Left hip rising, hiking up. And finding level posture. Back to 2 feet, shake the right leg, left leg, right leg, left leg, and then brush down the right hip. All the way to the right foot. Last time. Taking a moment to stand and notice. In particular, check in through the low back, the hip, the knee, the foot. Some of you might already be feeling a difference. More flow, more grounding, more comfort perhaps, or stability on the right side. Check in now with your balance. Stand on the right foot and stand on the left foot, the hip we haven't done yet. Might be a slight improvement in both sides, although some of us might be really aware of the strength and stability on the right hip. I also notice more tone through my low belly on that side, and my foot feels really spread out. Good. Take a moment to let that go. And of course, as we do the second side, focus on efficiency. So if you're standing on one foot and you notice automatically that you clench your jaw or tense your shoulders or whatever other pattern might happen, do your best to spare a little bit of your attention to inhibit those patterns that are not efficient. Excess tension prevents healthy functional movement. So inhibit those tension patterns that are not needed, turn them off, and then the rest of your attention and brain power goes to the hip activities that we're doing. Here we go. So standing on the right foot, left leg is out to the side, hip socket and ball in the socket turning in, and then roll the ball out. Turn left thigh in, left thigh turns out, turn in, turn out, turn in. Spread the back of the pelvic floor or piriformis. Posterior muscles contract and draw the femur around. 2 more times. Slide them apart as you turn in. Slide them together to turn out. Last time, take a breath. Widen the back of the pelvis, turn the thigh in. And contract, engage, turn the thigh out. Good. Step onto that leg. Stand on the left side, left femur driving up into the pelvis, strong stability. And we're going to take the whole pelvis around the femur head. So spinning the socket over the ball. A few times, nice and easy. Navigating with your balance, trust your efficiency. I can move smoothly, I can breathe calmly while I swivel my pelvis around my standing leg. 1 more time. Good. Coming back to neutral, parallel, easy posture. Pelvis is fairly level. We're going to let the right side of the hips drop down. Right iliac crest down. And then hike the right hip up, up, up. Feel that outer left hip engage. You can put your hand there. Right hip drops or droops a little. Right hip hikes up, up, up. Engage outer left hip. Breathe. Right side down. Press into the standing foot. Hike the hip up. 1 more time. Right side of the pelvis down. Right side of the pelvis up, up, up. And finding level. Shake it out. And then brushing down the low back and pelvis on the left side, all the way to the foot. Good. Take a moment to notice. Energetically, you might feel calmer having done a practice. You might notice your pulse a little from the movement. and noticing structural sensation. Can you feel, are my legs more connected, more grounded? Do I feel more spread through my feet or anchored into the earth? Do I feel more lifted, tall, supported from having done this practice? And check in also with your balance. Notice, single leg, check it out. Other side, here we go. Observing any useful changes. Good. I definitely feel more calm through my back, more natural engagement through my deep core and pelvic structures, just feels more steady. So if this practice helped you, I want to hear from you. Leave a comment and let me know, wow, this is useful, this is challenging, it feels like something I really need to be practicing more often. And of course, if you have questions, or for some reason if the practice wasn't clear, didn't work for you, I want to hear from you as well. So feel free to private message me or find me through my website, sherrydostel.com. Thanks for watching. Happy strong hips to you as you practice, and I'll see you next time. Bye.